let's learn the bones of the lower limb. So that's going to be the femur, the tibia, fibula, and then the tarsals, metatarsals, and phalanges. That's it. Oh, I forgot the patella. That's in there too. So we will go from proximal to distal as we did for the upper limb, starting with the femur. The femur is a huge bone that has a distinctive shape. It has a head and a neck that connect it to the long shaft. It has two huge markings that form attachments for muscles called trochanters. These are the only trochanters in the body. And because of that, it has an intertrochanteric line on the anterior side, intertrochanteric crest on the posterior side. Note, there's a big difference between the anterior and posterior side that is easier to see when you can spin this around. I'm doing you a disservice if I don't show you this. But the femur, let's just get rid of everybody else. Come on. Okay, this is a femur. This is the anterior view of a femur. And the idea is it has this surface that a patella and a tibia can ride along when this bone, or when you flex your knee. And so when you spin this around, you see a very different structure, right? It's totally different in that you have these two giant condyles. This is a condyle, this is a condyle. I guess the closer you get to it, the more you can see it's really different. And so you have these two condyles on the posterior side. And the way to remember that is when you flex your knee goes to the posterior side of your femur. And so there's that bone there for it. You have things like the popliteal surface. Well, this is the popliteal region of your body. That's behind your knee, or posterior aspect of your knee. Also, epicondyles. Remember the epicondyles of your humerus? You can feel them by your elbow. You have epicondyles of your femur. And I believe... No, I can't feel those. It might be possible to feel those, but I just tried and I don't find it. Okay, let's see what all happened. So the femur is the thigh bone. It makes up the thigh. So this is the thigh, this is the leg, this is the foot. If it feels silly to have me say that, remember that most people outside of anatomy call this the leg, and this the ankle, and this the foot. In anatomy, we are concerned with describing motions or movements. And so we have a thigh that can be moved by certain muscles, a leg that can be moved by other muscles, and then a foot that can be moved by other muscles. And we kind of ignore the more common usage of those words. Let's see. I'm skipping through a lot of this because you can read it. Some of it is self-explanatory. Some of it is things I've said. I've mentioned the patella before. Well, there's not much more to say about the patella. One thing I would want you to be able to do is tell me whether you're looking at the anterior or posterior patella. This is a patella. And it just looks like a lump until you turn it over and see the posterior side. It has these two big smooth faces. And if you're trying to side a patella, there's actually a way to do it that you can just set it down on the table and it falls to the side and tells you what it is. And the idea is that it is it's asymmetrical and more of the weight is on the lateral side. So if it falls to the lateral side, that's the side it belongs on. So this is anterior, where it's lumpy and rough, and then posterior, where it's smooth, where it forms a joint with the femur. Okay, patella. And again, the patella, its whole job is to keep the patellar tendon away from the bones to improve this angle. If you wanted to extend the knee and somehow you had a muscle here pulling on it, that muscle wouldn't have to be very strong. But instead you have muscles here that contract, and they have to pull this way around the patella. And if they were just right here, it would be virtually impossible to extend the knee fully, but the patella allows that. Okay, so that's the femur and the patella. Now we're at the leg, the tibia and fibula. The tibia keeps, or it holds the entire weight of your body. It has a medial malleolus, and the fibula contributes the lateral malleolus. Let's find those. Those stick out. You can find those just above your ankle. Those are the big bumpy things that stick out just above your ankle on both sides. I'm going to try to put this skin on this model, and what you will see when I click this, first it's going to show you the fat. It's an ugly yellow color, and then it will put on this skin. And these bumps show you where the lateral and medial malleoli are. Yeah, so there's that. This is going to be where the talus bone goes, and you will see that in a moment. The head of the tibia has to be kind of flat to make the knee joint. The menisci go up here. And it has two condyles, just like we said for the femur. So if we go up here and we look at a tibia, and we hide everybody else, this is a condyle, and this is a condyle. And this would be where the medial meniscus would be, and this would be the lateral meniscus. The tibia, to remember right and left, one of the useful features is going to be remembering that it has the medial malleolus. So once you've found the malleolus, you know which way is medial. You can say, well, this is medial, that is lateral, and that means this goes on that side. And then if you can place it anterior versus posterior, you can figure out what it is. And I'll talk about that in a separate video. The fibula is the hardest bone to side. It takes practice seeing it. You have to actually just look at it for a while until you can recognize which end is which. And anyone who's done anatomy for a while can look at it and tell very quickly, but we all have different tricks. Anyway, the fibula, its job is to stabilize the ankle down here and also be a place of attachment for muscles, for some of the lateral muscles. There's so many muscles that are going to move the foot. The tibia doesn't give them enough places of attachment. So there actually has to be more, and that's my belief, is that that's what the fibula mostly does, is it doesn't bear any weight, and it doesn't move. It doesn't rotate the way the radius does in the forearm. Posterior aspect, anything interesting? Not really. Not really. Okay, we've made it to the foot, and here we have tarsal bones. Those are going to make up the ankle. Metatarsals, those are going to be the foot, and then phalanges, those are the toes. I guess the foot would kind of be here in the way you might think of a foot. This whole thing is the foot from the point of view of anatomy. Tarsals are these big irregular, I guess most of them are technically short bones, but they're these weird shaped bones. And just like the carpals, you have to learn them. Tarsals are a little bit easier. There aren't as many of them, and they're bigger and easier to see. And I have another great mnemonic device for the tarsals. So the way the foot works, this bone, the talus bone, has a smooth surface like this that fits the inferior surface of the tibia, and it's going to put weight onto this big calcaneus bone. That's going to be your heel bone. And that's going to take a lot of the weight. Most of the weight goes on your heel, but it's also going to push forward onto these bones. So the talus is also going to push forward onto these bones so that your toes, well, really so that your metatarsals and your toes can take some of the weight. Let's see. Yeah, cool. So here's what we have. Well, here is, you know, this might be my favorite mnemonic device. It's not as good, it's nowhere near as good as the carpal mnemonic device, which is straight line to pinky, here comes the thumb. That's amazing. But this one is funny because it's random. Who cares about tiger cubs? And milk is misspelled. How could you ever forget that they spelled milk wrong? So tiger cubs need milk. Okay, fine. Yes. Small mammals need milk. But you don't spell it like that. So that's how I can never forget this mnemonic device. How it works is you have the talus, tiger, cubs, calcaneus, and then you go like this. You go from the talus anterior, and then you'll go from medial to lateral. So you go talus, navicular, and then the three cuneiform bones are all kind of attached to the navicular. And they're just named medial, intermediate, lateral. And then the last one is the cuboid. So you have tiger, cubs need milk. See? Tiger cubs need milk. Old anatomy books have mnemonics like this. They're just random phrases that are terrible. And there's nothing memorable about that. If you want to make up your own mnemonic devices, make up something deeply inappropriate about someone you hate, and you will remember it really, really well. The best mnemonic devices I cannot repeat because they are disgusting, inappropriate, deeply unethical, just wrong in every way. That's very memorable. And so, yes, there are a lot of great mnemonic devices that you could remember even better than this because they're even more wrong than this. So those are the tarsals. The metatarsals are numbered the same way the metacarpals are, 1 through 5, but instead of the pollex thumb, you have the hallux, big toe. And so metatarsal 1 would be the most medial part of your foot. And then just like in the hand, you have phalanges, proximal, middle, distal, and they're numbered 1 through 5, and the big toe doesn't have a middle. It just has a proximal and a distal. So this naming scheme you already know from the hand. The difference is going to be there aren't quite as many of these as there are carpals. I want to say there are 7 tarsals. 1, 2, 3, 4, 5, 6. Yeah, 7 tarsals, 8 carpals, whatever. Yeah, so here you go, bones of the foot. Oh, the foot is so elegant. Look at that. Look at that. It's kind of funny in the anatomy lab because everybody gets models of each of the bones, life-size models. And so mostly people would have a life-size femur and they turn it over and they look at it, or they have a life-size rib, they have a life-sized sternum, pelvis, coxal bone. But what's funny is that the hand and the foot are fully assembled, and so people are turning this bony foot over. It's just funny to look at. Well, that's it. That's the bones. So the next video I make will be about how to know a left from a right, and I will make that video. But if you have gotten to this point, hopefully you have seen all the bones, And I hope I didn't just read these slides to you. I mean, what I was trying to do was explain themes and how it all works. Let me know if you think I'm just reading the slides to you and the videos are pointless, because I'm just saying the same things I would say in lecture. I am curious about what you think, so let me know, and have a good day.